Thank you very much for the opportunity to be at this forum and to share with you a little bit about the new developments in melanoma. It's been a long time coming, and yet we're certainly seeing some light at the end of the tunnel. And that's really what I want to share with you, is some of the positive changes and developments that have happened in this disease. Melanoma is not that common in Canada. It's certainly the most uncommon of the skin cancers, but still we see a significant number of Canadians who develop this disease. It's more common in men than in women, and your lifetime probability of getting it is anywhere between 1 in every 75 to 100 people, which really translates into having about 5,000 cases a year. And of the 5,000 cases or so that develop melanoma, about 1,000 will die from the disease. So certainly the majority are cured and live long, productive lives, but we still see a significant proportion, about 20% of people who with the diagnosis will actually die from the disease. One of the things that's particularly concerning in melanoma is the increasing incidence over time. From what was a very rare disease several decades ago, now is becoming increasingly common, as you can see. And these are just projected rates of a melanoma in the U.S. So back at, in the 50s, about 1 in 600. Now we're expecting 1 in 50. So almost a 10 times increase in the frequency of melanoma being seen in our country. And there's a number of reasons for that. And you'll probably recognize this as the poster for Coppertone, which was used a lot in the 60s and the 70s. But actually, this really is more an advertisement of what not to do in terms of getting melanoma. And some of the hallmark features of who gets melanoma are actually in this advertisement for Coppertone. So on the one hand, they're promoting getting a good tan, but actually the poster is promoting getting melanoma. So these are the major risk factors for developing melanoma. Probably the most important one is family history. If you have a first-degree relative, such as your father, your parents, or a brother and sister who have melanoma, that increases your risk of getting a melanoma by 3 to 5-fold. Certainly, if you've had a previous melanoma, then you're at risk of getting a second melanoma, certainly. Having multiple moles is also another common feature in our society, and increases your risk of developing a melanoma in one of these nevi or moles. As the poster illustrated, one of the risk factors is high sun exposure, particularly in childhood. And so that if you had multiple burns, particularly blistering burns as a child, that greatly increases your risk of developing melanoma down the road. The pale Caucasian skin, of course, is a major risk factor. And most people in our country are from sort of Northern European or British descent. And that skin type is particularly more prone to developing melanoma. That's not to say you can't get melanoma with other ethnic backgrounds, but certainly amongst the pale Caucasians, it increased. Red and blonde hair are also risk factors. Like in the poster, the little blonde girl. But in fact, the ginger people are the most increased risk of getting it in terms of hair color. And if you have red hair, it can increase your risk up to 10-fold. I mentioned the history of blistering burns. Also, melanoma is more common in the higher socioeconomic groups. And we think this is more related to sun behavior than anything. It's the richer people who run to the south to get their skin burned than not. And so this is definitely something we see people with both higher education and higher income brackets. And sunbed use. And again, this has been launched worldwide with the ruling of the World Health Organization that sunbeds increase your risk of developing melanoma, and particularly sunbed use as a young adult. Okay, well, what does a melanoma look like? Well, there's a number of key features that we look for in patients who have a suspicious lesion. And really, it's very important from a public health point of view to get these markers of melanoma out there so that people are aware of them. By far the majority of people who present with melanoma, it's the patient who actually identified the problem. Sometimes, you know, the family doctor will look at the lesion and say it needs to be tested, but more often than not, it's the patient, and also it's the partners of the patients. Certainly in men, it's the spouses or their significant others who are the ones who are most likely to identify a lesion that needs to be checked. So these are the sort of the hallmark features of a bad mole. First of all, asymmetry. So A is for asymmetry, and that simply means that the lesion doesn't look the same on both sides. An irregular border, again, looking at the edge of the lesion, it's somewhat obscured or changed, or it's not well delineated. So if you look like at a normal mole in your skin, you'll see the very clear margins around it. Some melanomas have this irregular border, so B is for border. C is for variability in color. So a melanoma may have varying pigmentation in it, and certainly if that's put together with changing pigmentation, that's a very suspicious sign. So C is for color, D is for diameter, so anything over 5 millimeters, which is like the size of a pencil eraser. So anything bigger than that is suspicious. And probably E is the most important one. A lesion that changes over time is really something that has to be looked at. So these are 5 sort of indicators that you might have a problem with developing a melanoma. The most common ones associated with melanoma are a change in size, as I mentioned, the E, the evolution, and change in color. So the change in size, a change in appearance are really important indicators that this needs to be checked out. Bleeding is relatively uncommon. Itchiness is also uncommon, and pain is almost never present. So, you know, those 2 features, the change in size and color, are the most important ones to keep in mind. And my perspective, again, I'm biased as a melanoma doctor, is if you have a lesion that you're suspicious about at all, it needs to be taken off. It needs to be biopsied and removed. And the only way you can really make a diagnosis of a melanoma is to look at it under the microscope.